Statistically, 30% of patients, 1 out of 3 individuals, will have kidney stones at some time in their life. And we've all heard of somebody, a family member, a friend, or even perhaps yourself, who has passed a kidney stone, and it is considered one of the more painful experiences that you can have from a healthcare perspective. Once a kidney stone is treated and removed, or the stone passes on its own, it becomes very important to prevent future stone formation. Again, statistically, half of the patients who've passed a stone will pass another one within 5 years. And so prevention becomes very important. Prevention focuses primarily on diet and sometimes with supplements. The best way to know how to prevent a stone is to do a stone analysis. So that means after I've removed the stone, or if a patient passes a stone, we send it to the lab to see what chemical composition it has and make dietary recommendations based on those results. Additionally, patients will often do a 24-hour urine collection. I'll give you a container and you'll collect the urine for 24 hours, and we'll send it to the lab to see what in the urine is predisposing you to kidney stones. Dietary changes can be as simple as drinking more water, reducing oxalate in your diet, reducing salt, reducing red meat, sometimes increasing the amount of lemon in your diet or the citrate in your diet. If changing your diet is not enough, we usually recommend supplements like potassium citrate, and sometimes even medication if the stone disease is significant. With all the advances we've had in the surgical management of stones, whether it's smaller cameras to get into the kidney with a smaller incision or no incision, better lasers that will help fragment the stones and remove the stones, sometimes we forget about prevention. And once a patient has passed the stone, they're often forgotten until they have another episode and they come to the emergency room with another stone 2 or 3 years later. And we have to remember that prevention is often easier to do than to pass a stone with all the pain associated with it.